Eduardo, maybe we start from, tell us a bit about who you are, what you do. I mean, we heard Kusnacht Practice a few times today, but some people have just walked in. So let's not assume that everyone knows what you do. Tell us about that.
Okay. Welcome, everybody. Can you hear me okay?
Yeah.
Is it good? My name is Eduardo Greghi, and I am the CEO and chairman of the Kusnacht Practice in Zurich. So I started over 13 years ago when we had just the first employee that I brought in, and the business has been growing organically. It was not planned. There was no business plan. The way I continue to grow the business was by simply finding out what do our clients want and need and putting it together. So it's basically by a helplessness. So I'm a helpless helper, and I want to solve problems. And I don't stop until I can do that. So by finding out what our clients need and want, and trying to bring the best solution to that, have built the Kusnacht practice today. We are to many considered a rehab, to others a clinic, a treatment center, and we are all of that. So we combine 4 pillars, which is we have medicine divided in 3 pillars: internal medicine, psychiatry, which is the main entrance to our door. Most of our clients come with addiction. That's how it started as a rehab, but then it kind of merged. We start to have more clients coming for other mental health disorders such as sleep, depression, anxiety, burnout, borderline personality disorders, bipolar disorders, eating disorders, and all related anxiety-related disorders and depression. And of course, many of these disorders are self-medicated by all kinds of drugs, prescription drugs, but also street drugs. Substance use disorder, alcohol use disorder is a big thing, but that's what's presented. So when you remove the behavior or the band-aid, we then find out that people have all kinds of underlying psychological and physiological needs. Our clients, when they come in, very often they'll also be struggling with, for example, diabetes, cardiovascular disease, and all other related issues, because they have let themselves go, and you cannot just remove the substance and treat that. You need to treat the whole body. So we added internal medicine. So today, one of the main investments that I have been doing the next 10 years by bringing doctors to work full time with us. So we have our own doctors, have our own nurses. We have permissions to treat children, and we can treat from 6 years old all the way to have clients at the age of 80, even older. So this weight differentiates us from classic rehabs or simple, which is not so simple, like medical spa or other clinics, because we have internal medicine, 2 professors on board full time. We have psychiatrists full time, 4 psychiatrists full time, and we have 4 doctors doing what can be called reverse aging medicine, functional medicine, which we call at the Kusnacht Practice precision medicine. These are doctors who then did further education in functional medicine and orthomolecular medicine and longevity. So we unite these 3 pillars of medicine with, of course, all the complementary therapies around it, from massage all the way to mindfulness, art therapy, music therapy, whatever you need, we'll bring together and put a schedule for our clients, which is as unique as your fingerprint. So there's no cookie cutter, no 2 days ever the same, no 2 hours ever the same. Our clients never see each other. And I'm very proud to say on clients always, I hope I will see a reaction here. So we have more doctors than we have clients at any given day. And our doctors will never see more than 1 or 2 clients a day. And so they have time to read the literature, they have time to talk to each other, they have time to call specialists in the region. And to finish my long description, we, of course, are very lucky because we are in Zurich and we have incredible connection with the University Hospital, Bethania, Hirsch London, and all the other local hospitals such as Spital Mennedorf and for example, and professionals because Zurich attracts the best professionals in the world because it's some private care. And together we have, amongst our doctors, over 100 years of experience, and we know who the best people are. So from the dentist all the way to clients who need a heart surgery or prostate surgery, we can find the best specialist and we guide our clients. So in this sense, we are kind of a family office for health.
Yeah.
So our clients, they rely on us for their family every level.
Thank you. And I'll also add, you mentioned our clients never see each other. Just for context, is because you do all this world-class care in private residences, right? And that's what makes you very unique. And on Zurich Lake, which is
On Zurich Lake, so if you know Zurich,
yeah,
the Gold Coast, which is
Yeah.
the side where the sun sets last, we stretch, we have villas from Zurichberg, near the Dodegrand, all the way to Herliberg. And we are pretty much in the middle. We are in Zolikon. We have our offices, we have our medical center. We have all the fun stuff like cryotherapy and hyperbaric chamber, all these things that clients like, but also, of course, the serious stuff with our doctors. And all our villas are 10, 15 minutes away from our office. So if this was our office on scheduled times, we go down the lift, we have smart cars, and our doctors go to the clients. So what does this mean? We have 10 villas at the moment, one being renovated and rebuilt. Our clients, like a Swiss clock, will receive their doctor at their door. Every client has a private chef cooking healthy food for them. These private chefs are trained, educated. They have a certificate, a BioR certificate with Dr. Antoinette's team. She leads that team, and they know what to cook. Of course, we cook based on your religious background, on your needs, and also based on your medical reports. Because when we do all our tests with our clients, our team gets over 300-page long report on your unique body and brain chemistry. And they define your diet, supplements, physical exercise, sleep hygiene, and so 80% of your treatment comes to you to your villa. And you also have a companion, which can be considered sometimes as a high-level PA, and often even a doctor living with you. So you have, we call them living counselors.
Yeah.
We match this living counselor to the client. So it means female mostly with female, male with male. So you'll be in your home, which are beautiful villas, beautifully furnished. And you have your private chef, we have our maids, we have our drivers. Everything is 100% bespoke and confidential. You can do therapy in the car. Our drivers, they don't even hang out with local drivers when they drive our clients to the Dolder brand. They're not allowed. So, and like that, and 20% of it is coming to our office because we have, of course, things like RTMS, neurofeedback, biofeedback, and of course, sessions in the office with the team. And of course, the local.
Yeah.
We'll take our clients to an ENT doctor, to a cardiologist, to an endocrinologist, gynecologist. So it depends on what the client needs.
Yeah.
We will also pull out the resources from around us.
Yeah.
If it makes sense.
Thank you, Eduardo. And obviously what you do is it's fascinating, and how you were able to grow this company and bring it to a place where people come from all over the world to you, right, for this kind of care. And I'm curious, you as a leader, because like you said, you were there from day one, first employee, to now what is a company that you just described. On that journey, like at what point did you realize the way I've led until now, the way I've operated until now is just not working anymore,
Yeah. I just realized that I cannot do everything anymore, right? Because I was walking my clients' dogs, I was picking them up at the airport, receiving the first call. All the phones were diverted to me until 2021, I think, more or less, in the evenings and weekends. And I couldn't add more hours to my day, right? And I have so many 16-hour, 18 hours day. And it's pretty much, I'll be blunt, it's kind of an arrogance. You have to let go. You just, you have to finally realize that I'll kill myself. And I've seen my clients coming to me with the same problem. So you need to walk the talk. And that's when I realized that I need to let go of being the hero. I have also to stop being arrogant and realize that there are people out there who can do many of the things that I'm doing much better than me, right? And start to bring those people. You need to invest. And I realized that my focus has to be on bringing the best people on board. That's my number one goal. And then let go um, of being judgmental, of criticizing people, right? Take responsibility, um, and realize I co-created or created where my company and where I am. So it's pointless. I can blame others and feel good. I have to realize, hey, how did I get here? And there's an exercise I do. It's like Harvard is calling and say, Eduardo, you have this bad situation now, or whatever it is not working. So we want you to come and give a lecture to us. How did you get here? For example, I don't know, you can give me an example. Let's say you have somebody who is underperforming, and or let's imagine, and I have friends who did it, and I semi did it. Let's imagine you increase the amount of employees, and the revenue is not exponentially growing. So let's say, for example, you have 100% more employees than you need, and your revenue didn't grow with it. I can go back to the day one that I started my company and tell you how I did it, right? I hired the people and I allowed them to hire more people, and maybe they hired the wrong people, and then we hired the right people, but we didn't give them the coaching, we didn't give them the training, and we allowed them to, and we rewarded them probably for the wrong behavior, not for the right behavior. So, and then, that's how I created this. Don't blame others. And then it's very relieving because then you take responsibility and you can start to work on changing it. Because you always co-created in a way or another, you play a part in it, no matter where you are. So when I realized that, and I started to also honor myself, take more time, take care of myself, and become more the coach rather than the hero, the challenger rather than the villain. So that kind of helped me a lot, and lots of coaching. So on a panel before this, I get a coach. Yeah, I can't agree more.
So, and what was the hardest shift? You talk a lot about like stop being arrogant and just like let go and all of that. But I'm curious, what was the piece that was the hardest, that perhaps took the longest, and maybe the piece that you still occasionally struggle with?
Oh, hold on. I took a note or two here.
All right, I'll take a sip of coffee.
Yes, do that.
I know, it's a tough one.
I would say it's about honoring yourself. It's about being okay with saying no, being more sniper, take your time and really value it more than money. So I cannot answer everybody to write to me, who writes to me. Anyone who wants to have a meeting with me, right? To give an hour to somebody, you gave more than 10% of your day away. Normal office day. So the part that I struggle is is to be more sniper with my time, to say no, to be okay with that. Again, it goes back to not being the hero and the pleaser anymore, and to compartmentalize.
Yeah.
So because I built this business from scratch and I identify myself so much with it, and I'm not happy if a client comes in, and nobody in my team is happy if they don't get better. Really, we rather, and very often we have done this. Say, okay, no, we'll treat this person or come back because we're not happy if they don't get better. That's our passion and mission in life, and we fulfill this mission and passion through our clients. And I thank them every time. We have a goodbye ritual to our clients. And one thing we say when they're leaving the villa, we say, thank you for the trust in my team, in myself, and thank you for allowing us to fulfill our purpose in life through you. Because by helping you heal and get better, and be a better father, a better boss, a better leader, a better husband, a son, a wife, we fulfill our mission in life. So to me, to compartmentalize some problems that I have in the business, not only between the business, but also a problem, let's say a knife in the company is not a knife in me. And to compartmentalize that, to be able to analyze that with, without emotions, right? That really helped me to make a huge shift. Yeah.
Eduardo, thank you so much for such an open and authentic exchange. I know these are not easy questions, but I'm sure the audience enjoyed. Thank you so much for the time.
It's my pleasure. Thank you.
You did so.
Thank you.